Frustrated with reaching out to a client's prescriber? Scared that if they respond, they'll be dismissive or make you feel less than? Hi, it's Brain Bites with me, Dr. B. I'm Jessica Beachkofsky, your friendly online psychiatrist. Today, we're talking about how to get prescribers to answer your clinical questions. Let's dig in. So let's start with reasons why to talk to a prescriber in the first place. Maybe you have medication questions or concerns, or perhaps you're coordinating care to be sure the treatment goals and the therapeutics are aligned. This can be important for monitoring progress or for assessing med side effects and compliance. Part of due diligence in providing holistic care is to keep in touch with the other providers, and also for client education, helping them to better understand the prescriber's treatment decisions, how medications work, and why compliance matters. So what are the challenges when requesting information or a call from somebody's prescriber? Well, many people are worried about confidentiality and disclosing too much information. But in general, if you're staying focused on what the prescriber would need to know about your client and the conversation revolves around that, then you're fine. Make sure that you have a signed release of information, though. There can be challenges when maintaining professional boundaries. You may be worried about looking like you're challenging the prescriber, or that maybe you actually are. There are a lot of time constraints when you're trying to get two busy providers together. You're busy, the prescriber is busy. We've got to figure out a way to get everybody in touch with busy schedules. And then there are having different perspectives. It can be hard to see things the same way or agree on treatments or diagnoses if you don't come from the same direction. Some therapists worry about not being taken seriously or being misunderstood. You might worry about how this affects the shared patient, how the treatment or relationship might change if you talk to the prescriber. And then there's always not having some of the information, especially about medical issues that may impact the situation. There just may be information that isn't available to you that the prescriber may have. We all have different kinds of jargon and different ways of explaining things. So sometimes, even if we're on the same page, it can still seem really confusing. And the biggest concern of all is that the prescriber won't even respond. So why do you think a prescriber wouldn't respond? Well, there can be a lot of reasons. Perhaps it's just that the contact information is wrong. Either your contact information to them or them contacting you. The clinical question wasn't clear. Maybe they are busy and they think they're going to get around to it and they just haven't yet. Maybe your request is too long or confusing, or maybe it's just vague. Perhaps it seems like you're requesting too much information all at once. Maybe it got lost because it was sent on a Friday afternoon. It's not because they don't care. I want to share a little bit about psychiatric residency training. Every psychiatrist has gone through psych residency, and every residency includes a section of time on the consult liaison service. So I will say that coming from that training, that portion of training, I am always a little bit prickly when somebody asks for more information on something. It is very common when you're a resident on psych that people will ask you for consults on things that seem so trivial. My patient is crying and they have been sad and I feel like they should see psych. Like, that's not a clinical question. There's no real thing that you're asking me to come and do with my expertise. Talk to the patient. If they're sad, figure out why and try to address that. We don't have the same thing going on when you as a therapist are trying to reach out to us as a prescriber and we have a shared patient. But I will tell you, if it's a psychiatrist who got enough of those silly calls that weren't necessarily appropriate for us, we are a little bit sensitive when we get requests for information that seem like they might be frivolous. But I am going to be very clear on the things that you can do to be sure that your requests get responses. But that's where most of us are coming from. So it's not just because we don't want to respond. It's because we actually have a lot of baggage associated with the questions in the first place. All right. So what is the biggest way to do it wrong? The biggest way to be wrong about sending out a request is being vague and rambling. Giving too much information but not really knowing exactly what you're looking for and stating that will almost never get you a good response. So how can you do it right? Well, I have some examples for you, and I will link them in the notes so that you can see what I'm talking about. It's very simple, very clean. So you need to have your client's full name and date of birth. You need to have all your contact information, your credentials, your license number, just so we know you're legit. You need my information, so make sure you have the prescriber's information correct. And then you should always let us know that you have a release of information signed and on file if we need it. We won't always ask for it, but it's good to know that it's there. But the most important thing to make sure that you get responses is a clear clinical question. So what do I mean by a clear clinical question? Be very specific. Know what it is you're reaching out to the prescriber for. If you can't put it in one question, then you haven't figured out what the clear clinical question is yet. So you don't want to just say, can you show me all the medication changes that my client has had in the past? That is very non-specific, unclear, and there may have been dozens and dozens of changes over a very long period of time. So no, you can't have that information. That is too complex, it's too vague. What are you asking for? What's the point? Now, saying my patient started medication over the summer, I'd like to know for the past 3 months what medication changes have been made so I can try to align that with what side effects they're talking about in our sessions. That's a clear clinical question. It also helps if you have a time frame. So if you can say in the past 3 months or in the past 6 months, or give something more specific, that also helps so we know which records to go to if we don't have the information off the top of our head. Be specific about any kind of medications or diagnoses that you're asking about. And know why you want to know. Tell us why you want to know. We want to be sure that you know what you're going to do with the information that we're going to give you. Give us a place to respond and how to return the information to you. Now, if you want to share more information or if you feel you need to give context after the clinical question, you can provide a very brief summary that applies to what you're asking. If it relates directly to the question or is important surrounding information about your client's care, you can put that in there, but make sure it's after the question so we know what we're looking for the answer right up front. And if possible, include a please respond by date so we know that there's an end point to wanting this information, but also be a little bit generous. We can sometimes get a little prickly when you want the information within 48 hours. Be sure to follow any HIPAA compliance with any sort of transferring of data or sharing information. And follow up. People are busy. People forget. It doesn't hurt to follow up and say, hey, I'm sent a request for this information. I'm just following up. If you're requesting a phone call, be clear in why you feel like this needs to happen in a call. Calls can be a little bit trickier when you're trying to get information that way, but it's often the best way to have a conversation with somebody's prescriber. You can also give a brief summary of what you're looking for, what you would like to discuss over the call, and you can offer to provide a summary after your call so that can be used for documentation for the prescriber as well. With this, it's really important to offer flexible timing. State if it's urgent. If this is really important, you need to state that upfront. Bold. Let everybody know this is really important. We are on the same side. We both want this person to feel better. We're talking about improving care coordination, aligning treatment decisions, therapeutic approaches, so that the patient is getting what they really need. At one point, I referred a patient recently that I was concerned about for trauma and CBTI. So I referred her to a colleague of mine. And when we met up after she had had her consultation, we talked about it, and she was like, your patient did a sleep log, and actually her sleep looked good. We don't need to do CBT. I think we're going to dive right into the trauma stuff. Super helpful for me. So then I could reinforce that when I talked to the patient about her insomnia, because it wasn't really looking like that was the picture at all. So you can get a better understanding of medication effects and compliance, and we can both sort of figure out what's really helping. What are the problems? What's the medication causing? But what is the hang up with being compliant? We want to make sure they're taking medications as prescribed. So if we both know what the client is supposed to be doing, then that helps us ensure that they're actually doing it. So we can see what improvements are there. What are the problems that seem to line up with the medication changes? What are expected things and what are not? We also can use this for more accurate diagnoses. There are more observations between a couple of us, and we have more insights to offer. We can put our heads together and figure out what else might be going on. You get a more comprehensive view of the clients, and maybe for diagnoses that are unfamiliar or concerning medical or substance issues. Working together leads to better treatment outcomes because the patient or the client is consistent no matter who they see. It's always good to make changes with more information, and a discussion or shared information can improve targeted decision-making for either you or the prescriber. And this is good for safety. It's good for monitoring risks of treatment or of patient behavior related to the diagnosis or medical conditions. I had another experience with a therapist after we had been sharing a patient for about a month or two. She called and said, "Did you know that your patient has a drinking problem?" I said, "No, I had no idea." The patient that I had been treating once a month with Zoloft had had a DUI, had lost his license, and was drinking excessively every single day. And he was very open with this information with his therapist, but whenever I asked him any of the screening questions, he shut me down. There was no problems, no issues, no nothing. And so the next time I saw him, we were able to address that. She had addressed that with him as well, that we are on the same page. Very helpful for treatment. And it's fun. It's fun to work with colleagues together to benefit someone else. We are sharing things so that we have wins for everyone. Everybody wins. There's also the opportunity to learn a little bit more about a mental health adjacent topic. So I recently learned more about brain spotting and EMDR, and I love to share medication information or other medical information that may be impacting a particular client. People feel good when they know they have coordinated care and will get the support and reinforcement they need, whether it's from their therapist or their prescriber. So what about troubleshooting? No, this is not going to work for every single person that you reach out to. Not every prescriber will respond to you or in the timeliness that you request. You may not even like the prescriber you talk to, or they may not agree with your treatment approaches. But just remember the person that you're trying to help, get the information you need, and just leave it at that. So just to sum up what you really need, you must be clear and concise. Put the important stuff first. That's called a bluff. In the military, it's a bluff. Bottom line up front. All the emails that are long start with the bluff, so you know what the point is before you get down in the weeds. Explain why you need the information or the call and that it won't take long. Be flexible in getting the information, whether it's setting up a call or just receiving the information back from the prescriber. Hopefully, this helps us get wins for everyone. I hope your brain is full of collaborative goodness, no referrals required. Be sure to enjoy more tasty tidbits at brainbiteswithdrb.com. Enjoy.